One of the new procedures in UK, relatively new procedures, is the mini-gastric bypass. It's there in UK over the past 3 to 4 years. However, it's been performed in the world over the past 20 years. What entails the mini-gastric bypass is we separate a tube from the stomach and we connect it directly with the small bowel after bypassing about 2 meters. Significantly powerful procedure in comparison to the normal gastric bypass for 2 main reasons. First, it gets more persistent weight loss, and second, it gets fewer complications in comparison to the normal gastric bypass. So, from the point of having more persistent weight loss, because it creates more aversion towards sweets and fatty meals, and accordingly will have slightly more malabsorptive effect, and according to that, more powerful and persistent weight loss in comparison to the normal gastric bypass. From the point of view of complication, it's a shorter operation, so the chance of having clots in the leg, clots in the lung, chest infection is less because the patient spends less time on the operating table. The second thing, it's only have one joint, so in comparison to the normal gastric bypass have 2 joints. So statistically, there is less chance of having problems. And the third factor, it's if the patient have any problem in the future, like weight regain, for example, it's much easier dealing with this weight regain in the mini gastric bypass in comparison to the normal gastric bypass who get 2 joints, so therefore any weight regain is technically more demanding. So in summary, it's actually a very powerful procedure. It gets more persistent weight loss and it had less side effects.